Welcome to today's webinar, Measuring Outcomes in Services for Human Trafficking Survivors. My name is Susan Howley, and I'm the Program Director for the Center for Victim Research. The activities of the Center for Victim Research and the materials being presented during this webinar are funded through grants that come out of the Office of Justice Programs at the U.S. Department of Justice. Our support comes from the Office for Victims of Crime, and our presenters' support comes from the National Institute of Justice. The Center for Victim Research is a one-stop resource for victim service providers and researchers. We want you all to be able to connect and share knowledge, and this program itself is a partnership of researchers and practitioners made up of the Justice Research and Statistics Association, the Urban Institute, and the National Center for Victims of Crime. Today's webinar provides important insights into an aspect of evaluation, identifying and measuring outcomes for service. You'll also learn what it means to validate or prove up a measurement tool. And now it is my pleasure to welcome today's presenters. Stacy Cutbush and Samantha Charm are from RTI International's Division of Applied Justice Research, and Philip Gnedig is Interim Co-Director of Empowerment Programs at the Coalition to Abolish Slavery and Trafficking. And with that, I'll turn things over to Stacy.
Thank you, Susan, for hosting us at the Center for Victim Research. Good afternoon, all. My name is Stacy Cutbush, and I'm a research scientist at RTI International. We're here to share with you our human trafficking outcome instrument study funded by the National Institute of Justice. I want to acknowledge the study's co-PI, Deborah Gibbs, as well as my co-presenter from RTI, Sam Charm. Our primary study aim hinged on advancing a human trafficking quantitative measurement tool, specifically a program evaluation instrument, that is designed to measure change over time for several key outcomes among labor and sex trafficking survivors receiving comprehensive services from human trafficking programs. This study we conducted is predicated upon a human trafficking program evaluation tool initially created by our colleagues at CAST, the Coalition to Abolish Slavery and Human Trafficking. We have tremendous appreciation and respect for our colleagues at CAST, and one of them, Phil Gnedig, is here with us today to discuss the inception of that tool, of that initial tool we built our study upon. Thank you, Phil.
Thank you, Stacy, and it's a pleasure to be here with you all and talk a little bit about this tool from our side of things and give some of the background. Without going into all of the detail, just for context, CAST work, a full-scope comprehensive service provider in Los Angeles, California, working with any victim of human trafficking, and it includes some policy work as well. But for the purpose of this discussion, wanted to just frame where our history of using an assessment tool started and what our framework thinking was behind all of that. We were formed in 1998 as a nonprofit focusing on this issue, and as you can imagine, there weren't a lot of practice guidelines at the time in terms of what tools do we even use, how do we conceptualize assessment and outcome measurement, all of that. And when we first started thinking about an assessment, we were, as an agency, literally 3 people sharing a desk in a borrowed office. So a lot of what we were looking to for models came from the international human rights frameworks, and we pointed to the 2000 UN Protocol on Human Trafficking, which came around at the same time as the TVPA nationally. But the important piece was we made a conscious decision to be holistic in our approach and be comprehensive, even though the resources at the time probably limited things really to job training and employment placement and maybe some housing components. But in developing an assessment tool was really a choice to say, even if we don't have capacity for all these things, we want to be measuring as much as we can in our clients because we know it impacts them holistically, so we want to be holistic in our support. So as the tool evolved, we, obviously included some of those elements from the UN protocol as a rights-based approach of, wanting to assess housing, access to counseling, material assistance, all of those areas. And over time, we expanded our tool to 12 assessment areas. And so that meant this was something our caseworkers were using on a regular basis to have those collaborative conversations with clients to assess where they're at and then establish the goals together. As part of that evolution, we also developed a scoring scale that, again, because of the lack in our field of the practice guidelines, we borrowed language from the anti-sexual assault field of that crisis to thriving idea of a scale. And I'll get more to the scoring a little bit later, but one of the distinctions that was part of this approach and framework was really an emphasis on outcomes for our clients, not just outputs. We didn't want to only be tracking the service units or the hours we were putting into the work, but to really bring in that social work, strengths-based approach. We were integrating client input and their view of the issues they were facing and the barriers, and then be able to track that systematically so we could see across the board how we were doing ourselves and also how our clients were doing in the systems they were engaged in. And this is just a little bit of a screenshot of how an evolution of our tool looked. Just to give some context, that built into it is our prompts to have these collaborative conversations where we're assessing for knowledge and access to basic rights, always highlighting client strengths, and then through that process, collaboratively bringing in that problem-solving case management approach to establish client goals. This is just an example of how the scoring works for our housing component, but you don't need to take this in too much because it looks a little different with the RTI tool. But the scoring, once we started that about 10 years ago, has become this invaluable component to our program. And I just wanted to highlight as a practitioner and as a service provider why it's become so integral to what we do. We, as I mentioned, started collecting those same data points 10 years ago. So as you can imagine, it's ended up becoming a very rich source of information for us to understand what's going on. Because of that, we're collecting the same data points roughly every 3 months for every client throughout the course of services, just as you would do an initial assessment of someone, and then the check-in reassessments, and then looking at whether they're maybe ready for graduating or moving on. The keys here is it really helps us evaluate in a data-driven way the effectiveness of our programs. It's a way to kind of track any types of trends we might be interested in too. So for example, we've been able to see some of the gaps in partnerships and housing resources for transition-aged youth versus some of the adults we serve, or vice versa. And even though the scoring might initially seem like, oh, we're scoring clients and how they're doing, it's really been a way to identify where systems might be failing them or where there's gaps that we need to shore up. So being able to, with data, identify those systemic barriers has really helped us in our policy advocacy, as well as engaging new stakeholders in those issues. It's also been a really effective tool for us to demonstrate impact for funders. I think we can all acknowledge in the anti-trafficking movement, there's always been this data vacuum that folks talk about a lot of the time. And by being able to measure impact and outcomes in particular for clients in a way that is driven by that collaborative case relationship, so that the scoring isn't just a third party evaluating someone's experience, it's really done in partnership with a client. It results in really meaningful and rich data, I think. And then it really has enhanced the consistency of our service delivery so that when we develop and enhance our programs, it's done in a data-driven way. Just to highlight an example, we, for instance, noticed some of the scoring that we were tracking being a slight difference in the gains our clients were making in their financial empowerment and financial literacy in particular. So we use that information and insight to inspire and sort of push for an investment in additional professional development and training through a new partnership so that our caseworkers are getting certified as financial literacy coaches now. And we're hoping that's a way to potentially bridge up that gap. But just another example of how you can then enhance your program in a data-driven way. And lastly, I just wanted to acknowledge from our end, as practitioners, we know that it is a luxury to have access to data and to be able to complete this and even get staff on board with this type of consistent documentation, whether it means access to technology for being able to digitize this or whatever form people are doing. But I think there's, as you'll see with the RTI tool that I'm really excited about, it's quite adaptable depending on capacity. And what I also want to highlight is our caseworkers have found it to then be, it's additive, not taking away from the work they're doing with clients, because they can use those conversations and the regular assessments to build out what they talk about with clients, the issues they dive into, and then have some numeric information to talk about all the progress someone has made or areas they might want to focus on more. And I spoke a little bit about the feelings around assigning scores, but I just encourage with the framing to think about this as ways as a movement and a network of providers we can really be identifying systemic barriers and not see scoring as judgment of clients, but rather insight into our broader systems. And as with anything, I think serving human trafficking survivors, we see the diversity of this client population, and it might seem we might be wary of a tool that can encompass everyone's experience and all the types of variables they might be encountering. But and now teeing up to Stacy and Sam, part of what's been so exciting to see the RTI project include has been such robust and thoughtful feedback loops with survivors and practitioners, so that I think what's resulted is a tool that can really capture and be adapted and customized to speak to a wide variety of experience and keep growing with that as our movement evolves. So with that, I do want to throw it back to Stacy, and thank you all.
Well, thank you for that excellent context, for your work developing the initial CAS tool, and importantly for your participation in our study, which I'm going to talk about next. For our RTI study, we took as our starting point the instrument developed by CAS that Phil just discussed. Our aim was to build upon it. We know service providers face ongoing challenges with evaluation of trafficking programs. Phil just spoke about some of those, and there are more listed here. First, many human trafficking programs do engage in evaluation, but these focus almost exclusively on process and outputs rather than outcomes. We also understand that survivors exiting trafficking face numerous challenges and that no single marker represents progress towards successful outcomes. Rather, we must consider and measure a constellation of outcomes. Finally, we know programs face challenges measuring client progress. Challenges include, but are not limited to, documenting seemingly small but important steps clients make towards rebuilding their lives. We also consistently hear that data management and analysis is challenging because case managers' first priorities are naturally serving clients, not managing data. Challenges notwithstanding, we need outcome evaluations to inform program development and document program impact. So the question then becomes, how do we as a field capture client progress towards successful outcomes? We at RTI are committed to establishing a foundation for evidence-informed services for human trafficking survivors. Our study goals were to refine and then test, and refine and test, and refine and test again, a program evaluation instrument designed to capture client progress in domains relevant to key outcomes. I'm excited to report that we have completed instrument refinement and testing and are now preparing for final instrument dissemination. In fact, my co-presenter Sam will demo this instrument, including how to use it and its data management and visualization capabilities during our webinar today. In addition to generally refining and building upon CAS' existing outcome instrument, we also saw here an opportunity to advance a measurement tool by assessing its validity and reliability. So what is validity in the end? What does using a validated tool mean for practitioners? As a process, validation involves collecting and analyzing data to assess the accuracy of an instrument. In other words, do the measures or questions accurately assess what we want to know, what in fact we intend to measure? Does the instrument measure the concept that it's intended to measure? Reliability as a process involves analyzing the consistency of results across items or questions and respondents. The most useful instrument is both valid and reliable, so we set out to refine and test an instrument that would be both. To that end, we generated a three-step approach to instrument testing. I'm going to first discuss step one, the first box. We will get to boxes 2 and 3 later in the presentation. In step one, we completed an environmental scan of the literature, including every human trafficking outcome instrument that we could find. We then convened 3 expert panels comprised of survivor leaders, service providers, and researchers, respectively. Based on the literature and instrument review, coupled with collective expert panel input from survivors, practitioners, and researchers, we landed on this final list of dimensions or categories. Achieving this final list was no small feat. We did so by listening to and reconciling many diverse perspectives. You'll notice these dimensions cluster by the conceptual categories denoted by green font on the right. This list has 4 fewer dimensions than the original CAST instrument that Phil discussed. We then proceeded to apply inputs from the environmental scan of literature and instruments and from our expert panels to our set of indicators or descriptors within each dimension that you see listed here. This is the housing dimension. Let's take an in-depth look at example descriptors located in the columns here. Before doing so, though, I want to emphasize that this is an earlier draft of the housing dimension and descriptors. It's just a snapshot of where we were at this particular stage in the study. So we'll be showing you the final version of the housing dimension when Sam demos the instrument at the end of today's webinar. As you can see, there are 5 anchors across the columns ranging from crisis to vulnerable, stable, growing, and thriving. We retained the anchors themselves from CAST's original tool. However, in response to our literature and instrument review, coupled with the expert panel feedback, we substantially revised the existing indicators or sets of descriptors under each of those anchors labeled 1 to 5. The revisions we implemented included introducing a client priority option. You'll see that in the leftmost column, differentiating between adult and minor clients, adjusting items to capture baby steps or small incremental movements across anchors, having a sensitive instrument, focusing on realistic expectations, particularly at the end anchor points of 1 in crisis and 5 thriving. We systematically then made similar revisions to descriptors in each of the other 13 dimensions. Oops, sorry about that, I skipped a slide. Okay, so now let's look at the second phase, box 2, assess and improve scoring of our descriptors or items. Phase 2 consisted of 2 activities, a scoring exercise and cognitive interviews. So I'll first briefly describe our scoring exercise, and then I will kick it to my colleague Sam to discuss the cognitive interviews. So our goal is to assess the validity or accuracy of the descriptors that we wrote and assigned to anchors 1 through 5 on that crisis to thriving scale. We asked participants about how the instrument's descriptions of clients who are in crisis, stable, or thriving conditions compared to their lived practice experience. Our activity included 23 human trafficking program directors and case managers. And here's a screenshot of our online survey programmed in VoxGo. We had respondents assess all of that list of dimensions I showed you previously, but we only had them assess the descriptors for 3 of the 5 anchors, namely in crisis, stable, and thriving. We used this approach because 1, asking about all 5 anchors would have created too much burden for respondents, and 2, we were confident we could adjust the in-between anchors, anchors 2 and 4, based on the feedback we got from anchors 1, 3, and 5. So on the screen is an example of the housing dimension with the in-crisis descriptors. In that top gray box, we provided the dimension name and the definition for that dimension. In the middle gray box, the respondents were asked whether they thought the description was too negative, about right, or too positive to represent a client in crisis. If a respondent endorsed either too negative or too positive, that final comment box appeared, the open-ended field, so they could provide feedback for why they chose that response. The set of steps was repeated for the stable and thriving anchors for housing, and then the case manager completed the same process for the 13 other dimensions. We were very pleased by these strong results. This graph shows the percentage of about right responses at the high level, organized by the overall conceptual categories that I flagged for you previously. They were denoted in green font. So overall, respondents indicated our descriptors are accurate. Across all dimensions, on average, 85% selected about right. Although the dimensions here are aggregated at a very high level, we did look at them one by one. For individual dimensions, the percentage of about right ranged from a low of 71% to a high of 100%. We can see that our descriptors were slightly more accurate for dimensions within well-being, safety, and rights. We had slightly lower about right scores for the categories social connectedness and self-sufficiency. This makes sense to us because those dimensions and categories are a little more nuanced and less concrete. We then set to work on revising all descriptors based on what we learned from this activity, with a special emphasis on the lower scoring dimensions. And we used findings from those open-ended text box fields to inform those revisions as well. So first, people offered divergent suggestions about the most important concepts to include. We were faced with tough choices concerning how to revise, but we focused on revising aspects of descriptors that clients can change through program participation, because this is, after all, designed to be a human trafficking program evaluation instrument. 2, respondents suggested that some language should be revised to be more strength-based or trauma-informed, and we were very happy to be instructed on that. 3, another comment we heard in this open-ended feedback box and at other times throughout our study actually, is that events are often outside clients' control. Yes, this is, of course, absolutely true. So we modified our instrument further to focus even more on client response to events and how we can capture change that might happen through program participation. Based on this feedback, we conducted extensive revisions of all of the descriptors. And before I continue discussing our process, I wanted to invite Phil back into the conversation at this point. Phil, as an active study participant, I wonder if you might be willing to offer some commentary here just on this process you participated in and the feedback we received, and more generally the importance of the relationship between research and practice.
Yeah, thanks. I was really pleased and encouraged throughout this process, and just took it as a model for how you all conducted it with that integrated relationship with practitioners and researchers, because there was so much nuanced tweaking, in particular with the language concerns or problems to work through that you were describing. I can remember, for instance, that getting into the weeds of all the nuances of what even just tracking employment authorization, depending on different pending legal statuses in the employment section, and how we work through all that in a few back and forth conversations. So again, to what I mentioned earlier, I think all of that rigor and those robust dialogues were not only useful and collaborative, but I think made the language really adaptable and nuanced that you guys used.
Thank you, Phil. Your voice and participation has been so meaningful every step of the way. We then proceeded to our next study activity, cognitive interviewing, which my colleague Sam will discuss next.
Great, thank you so much, Stacy. So our next step was cognitive interviewing, which is a type of interviewing focused on understanding how individuals mentally process and complete questionnaires or instruments. So the goal of our cognitive interviews was to really improve the clarity of the instrument and its ease of use. So we developed a protocol that asked case managers questions about general comprehension of the descriptors and technical terms, as well as the clarity of the instructions. We then recruited and conducted cognitive interviews with 9 case managers who provide comprehensive services to trafficking survivors. All of the interviews were conducted via Zoom web conferencing and using the screen share function. So interviewers could view the instrument on the participant's screen as they completed it and were able to see the steps that the case managers took to do so. And our interviews indicated that case managers were comfortable with the language included in the instrument and the different descriptors. And generally, when probed, they consistently interpreted different terms and phrases. However, the interviews indicated significant misunderstanding in how to logistically complete the tool. And having worked with the instrument for a long time, some of the things that had seemed intuitive to our team had really not been intuitive for the case managers. And most significantly, given that this is a measurement tool, even when given the same instructions for scoring, respondents used very different approaches and factors to calculate their summary scores for each category, meaning that 2 people who selected all the same descriptors in a given category were still ending up with different scores. So based on that feedback, we recognized that we needed to make some significant changes to the instrument itself so that the instrument would better guide case managers and take some of the work off of them. So I'm going to tell you a little bit about those changes that we made. You do not need to be able to read everything on the screen here. You don't need to. I just want to underscore that in addition to written instructions, we actually added visual instructions to try to make that process clearer to case managers. Additionally, we added other visual cues to encourage the completion of the instrument by row across. That included making each row and checkbox in line with one another and by alternating color by row. We also built restrictions into the tool itself to help guide completion. These still retained the flexibility that we wanted to allow case managers while ensuring consistent approaches. So for example, the instrument now only allows 1 response per row when before you could have as many as you wanted. Additionally, we now require a response in every row. So if a case manager doesn't have enough information to complete a specific row, instead of just leaving it blank, they have to select intentionally skipped. So we know that that was a purposeful decision on their part. And lastly, instead of the case manager calculating and entering the summary score themselves, that score is automatically calculated by averaging the score of each descriptor. And this ensures consistent scoring and does not require the user to do math, which I don't know about you, but in my book is always a good thing. So now I'm going to pass it to Stacy to talk about our next step.
Thanks, Sam. Here we are again at what should hopefully by now be a familiar slide. We have thus far discussed phase 1 and 2 of the study in boxes 1 and 2 respectively, and now we will discuss the third and final phase, box 3, and then Sam will demo the instrument for you, which is probably what you're most eager to see. Okay, so here's a more detailed overview of our third and final phase. By now, most fields have an established gold standard instrument, one that has been tested and deemed to be the most valid instrument in the field, capable of producing the most accurate assessments. However, the nascent field of human trafficking just doesn't have that yet. For this study, then, we needed to develop an innovative methodology that involved rigorous testing, but in a way that would not burden human trafficking survivors. So we instead developed and used qualitative narratives or vignettes as hypothetical client cases. We then asked two pools of respondents to assess our hypothetical client cases using our instrument. I will break down each of these steps in the next few slides. Here's a more detailed overview. Oh, pardon me. First, we created 6 qualitative narratives or vignettes as hypothetical client cases. We constructed each of the 6 hypothetical client cases to vary on a few key factors, including whether they were U.S. or foreign-born, adult or minor, and labor or sex trafficking survivors. We aim to represent clients who are diverse in terms of their status, for example, whether one is in crisis or stable on each of those original 14 dimensions, for example, housing or employment or immigration. We then asked several practitioners in the field to review and provide feedback on each of our 6 hypothetical client vignettes, and we incorporated their suggestions for revision. Here you can see a partial screenshot of one of our hypothetical cases for, again, hypothetical Estefania. So after creating each of our 6 hypothetical clients, we invited 5 very seasoned, highly experienced human trafficking program directors and case managers from around the country to participate in our study. We came to affectionately refer to these program directors as our Gold Star experts, and in fact, Phil participated as one of those. Thank you, Phil. We asked each Gold Star expert to rate each of our 6 hypothetical clients on each descriptor within each dimension. We then asked them to meet and discuss their ratings and come as close to a consensus as possible on their ratings to achieve what we considered then our Gold Star ratings. We then wanted to know how consistent are the ratings or scores for each hypothetical client among the Gold Star experts. After they completed their assessments, we analyzed the data to produce intra-class correlations, and I will share those findings momentarily. We then applied the same process, the same method, to a set of 36 case managers from various trafficking service provider organizations around the country. And finally, after both sets of respondents had completed this activity, we wanted to know to what extent do case managers' ratings agree with those of our Gold Star experts. And here are the results for each of these 3 questions on the next 3 slides, respectively. So here you see findings from our Gold Star experts. We analyzed their data, producing what's called an intra-class correlation, or ICC, which assesses how consistently Gold Star experts were among themselves. We were very pleased with these findings. 12 dimensions had an excellent reliability, higher than 0.9, while 2 dimensions produced reliability scores in the good range. The greatest discrepancies were on physical health items and social support items, but please note even these scores are still very high. Next, we conducted the exact same set of analyses, producing ICCs among our case managers to assess how consistently they scored among each other. The ICC scores were strong, above average, but lower than our Gold Star experts, which we expected, owing to their varied levels of experience and client populations served. 6 dimensions produced good reliability, 7 produced moderate, and 1 demonstrated poor reliability. Specifically, the dimension with the greatest internal discrepancy was the physical health dimension. And this finding actually made sense to us insofar as our Gold Star experts received training, kind of an informal training, verbal emphasis, both on how we are defining physical health in the instrument and how to operationalize that definition when scoring clients. So I'll talk more about those implications momentarily. Finally, we estimated ordinal kappa to assess the instrument reliability, or how well case manager ratings agreed with Gold Star expert ratings. Ordinal kappa estimates the percent of case manager ratings that were the exact same as the Gold Star ratings, adjusting for agreement due to random chance. It also gives partial credit for scores that are close. Our data fell into 3 categories. 5 dimensions demonstrated good reliability, 8 demonstrated fair, and 1 demonstrated poor. Compared to Gold Star experts, case managers scored most divergently on that parenting dimension there in gray at the bottom. So there's definitely some room for improvement here. While we would have loved for all dimensions to have performed in the good range, overall, findings suggest this instrument is performing better than average. We have evidence that the instrument has good utility. So there are some limitations to what we were capable of achieving in this study. We didn't have a gold standard instrument, as I mentioned previously, to compare our instrument that we're developing here against. We have therefore accomplished what we feel is an extraordinary task by testing an instrument's validity and reliability when there is no gold standard instrument. A second key limitation is that our test didn't capture real clients or survivors. Again, we did not want to burden trafficking survivors by testing an instrument on them. We instead developed vignettes, those hypothetical clients, and those served as a proxy. And we were trying to squeeze a lot out of those vignettes by having them encompass a full spectrum of trafficking scenarios and outcomes. This constrained the range of responses that were possible. In other words, we restricted the variance. And we also had a relatively small number of gold star experts and case managers, which reduces variability. We would like to test with a greater sample size to increase variability and representativeness, which will increase generalizability, and are already thinking about those future studies. Limitations notwithstanding, we have applied rigorous methods to instrument development, refinement, and testing throughout this study, and we contend the resulting instrument is more advanced and sophisticated than anything in the field to date. So finally, to wrap up before I pass it to Sam for the instrument demonstration, overall the instrument functions well. We're very pleased and excited to offer this contribution to the field. In future studies, additional refinement and testing of physical health and parenting will further improve the instrument's validity and reliability. In addition, training case managers on how to use this instrument, specifically the physical health and parenting dimensions within this instrument, will likely improve case managers' consistent scoring among the clients they serve. Nonetheless, compared to other instruments in the field, this is the most rigorously developed and tested human trafficking outcome instrument to date. We are proud of and grateful for the extensive involvement of survivors, practitioners, and researchers every single step of the way. In fact, there may be dozens of you here attending today who participated in our study, and we want to say thank you once again. So we're in the final stages of preparing this instrument for dissemination next month in May, and we expect to be able to deliver it to each of you via email free of cost, and we feel so excited about that. So my colleague Sam, with no further ado, will now demo the instrument functionality, including how to complete it, well, first including how to get it from us, but then also how to complete the instrument on a client, and to demo the instrument's data management, analysis, and visualization capabilities. So thank you, Sam.
Thanks so much, Stacy. So Stacy walked us through all of the work that went into this instrument. So the big next questions are, after all that, what does this instrument look like, and what does it do? So to minimize the burden on the client, this instrument is intended to be completed by the case manager, not by the client. And we've built this in an Excel file that includes the instrument and has several functions to make it usable and useful for practitioners. So not only can you input a client assessment using the instrument we developed, you can review or edit assessments that were entered previously. It stores the data from each time the instrument is completed, and the file will summarize some of the data for you. So let's take a look at the instrument itself, and please bear with me, it might take a minute for my screen to share with you. That being said, in the meantime, please know when we do distribute this instrument at the end of the month, there are a few ways for you to, next month, there are a few ways for you to request that instrument if someone at your organization would like to see it. One, some of you may have requested it during your registration for this webinar today. Additionally, you can request it during your evaluation survey at the end of this webinar. You can ask for it by email, and I'll give you my email at the end of this presentation, and then also in the follow-up email that you get with the recording of this webinar. So we're trying to make this as available to you as possible. So hope everyone can see the instrument here. The different functions that I discussed are found on color-coded tabs down here at the bottom of the file, and there's an instruction tab for each of those main functions. But let's walk through how you would complete the instrument for a given client. The first thing you're going to do is enter the client ID. And this field does not have any required formatting, so we hope it will allow you to be consistent with whatever client ID system your organization already uses. This may help facilitate combining data from this instrument with other data you might capture about your clients. But for right now, I'm just going to put a client ID of 1. You'll enter the date that this assessment is being completed, and then I'm going to move on to the outcome category rows, starting here with behavioral health. First, I'm going to read this definition in the left-hand column of what behavioral health entails here. And if behavioral health is an area that my client has identified as a priority for them, I'm going to select this client priority goal box. If I don't know anything about my client's behavioral health, or my organization doesn't deal with behavioral health, I can select don't know and then skip this category altogether. But to complete the category, I'm going to read across each row independently and check the box of the description that best describes my client at this point in time. Then I'll move on to the next row and do the same thing. And once I've selected descriptors for each row in a category, this summary rating will automatically calculate on the left. And then you would complete the same activity for each one of the 14 dimensions that we've discussed previously. I've already done that for the sake of not making you watch me do every single one. When you have completed all the categories, you click this Add Status Record button, and that data is going to clear out of the form that you were just completing, and it's going to move in here to this Client Status Data tab that includes all the raw data. If you wanted to review, edit, or delete entirely a record that's already been entered, you can do so on these blue tabs so that you don't have to make changes in the raw data itself. But let's look at the data that's stored here. Each row here is represents one time that the instrument was completed. And then the columns include the client ID, the date it was completed, and then all the scoring data for the categories that you completed. And the data that's here can be copied and pasted into a new Excel spreadsheet. And the Excel files are among the most common data formats. A lot of statistical analysis software and client databases are compatible with this type of file. So we hope that having the data already compiled in this format will help you integrate it with existing client data systems. And then we hope that this will also generally facilitate further analysis that you may want to do. But because we know that trafficking programs will have differing levels of data analysis resources, the instrument does do some summary analysis on its own here in these green tabs. So this first tab shows summary data on the outcomes of an individual client on the date that you select. And this may assist you in identifying some of the areas where the client is doing really well or some areas where they're experiencing challenges. And this box here provides the average rating and the range of ratings for your client across all the categories on that range of 1 to 5. It also breaks it out to show you just the categories that the client identified as their priority. This table on the left breaks out those scores by individual categories, starring those categories that the client identified as their priority. And then we graph that same information with the orange bar showing you a client's priority. And this can also be used to give you a sense of the client's progress over time. Say that this data for client 1 happens at their intake in September of 2019. I could then take a look at their assessment from 6 months later and sort of visually see some increases and progress. And while I can see the changes in their overall ratings across categories and see more significant increases in the categories they identified as their priorities. And if you have interest in doing analysis to graph a client's progress over time, you have all of the data that you need to do that analysis right here. The last tab I want to show you provides you a snapshot of your client population, so all your clients together in a given time range that you select. So this shows summary data on the most recent ratings for all clients that got assessments during the time you chose. So this box shows you how many clients are included in this data, their overall average rating and range on that scale of 1 to 5, shows you their average summary broken down by category, and graphs that same information. So this can give you a snapshot of the needs of your group of clients that might identify areas where they maybe need more resources or the program may want to focus. So that's sort of a quick overview of this instrument and what it can do. I'm going to stop sharing my screen now and head back to the slide. And again, we will be sharing and disseminating this instrument widely when we are ready for release next month. And I just want to follow up by saying, we understand, you can get this instrument, but then what do you do with it? How can you use this information that it captures? So we understand that service programs for survivors are diverse in terms of their settings, their populations, and their services. So rather than to prescribe an evaluation process with this instrument, our approach was to try to make an instrument that provides valid and reliable information that programs can use to make data-driven decisions and continue to build an evidence base for survivor services. An important point is that even though the instrument is based on that holistic approach that Phil described earlier, it can still work for programs that don't provide services in all of those areas. Because it's broken down by category, a program can choose to skip the categories they don't address or to complete those categories, and then they can have data to inform strategic partnerships with organizations that do offer those resources. This instrument could be used as part of case management, as part of program and planning and communication, or outcome evaluation. So programs can use the instrument as a structured assessment to identify client needs when they first come into a program, or programs could repeat these assessments periodically because clients' situations change over time. Phil noted that TASK collects this standard data on clients every 3 months of services, but depending on your program structure, more or less frequently might make sense for your clients. Programs could use the instrument to get a sense of the overarching needs of their client population, or perhaps how these needs change over time. This information can help guide program decisions and help you talk about your population and provide evidence of where more resources are needed. And you may already know or have a sense of this information, but backing it up with data can be a really useful advocacy tool when talking with funders. You can also use the information about how clients change over time to evaluate the effectiveness of your program overall or after implementing new initiatives. We know that programs have been tracking their work in different ways for a long time, using measures of program processes and client satisfaction. And we aren't suggesting that this instrument replace those approaches. We just hope that this can help augment and add another important data point to create a detailed picture of your program and its impact. Again, if you want to get that instrument once it's ready, you can use one of the methods we talked about before, or you can email me here at my email address, scharm@rti.org. If you have questions about the presentation more generally, you can email any of us here. And then we really thank you for your time and for being here today, and we'd like to open it up for questions.
That's great. Thank you all. And we have had a number of questions come in already. I am going to ask Jason to go ahead and put the poll up now, just while I have the floor. But remember, you can still click on that chat box and reopen it to continue to ask questions. So let me go through a few that we have already come in. Several questions related to the point in time at which you are to use this tool. Is this at intake and then quarterly, or how often is it filled out?
Thank you, Susan. I'd be happy to answer that question. First and foremost, I would recommend that each program use its own discretion and how frequently to administer the tool. We consulted with survivors and practitioners and experts about this and are a little shy about making a firm recommendation because I think we really honor that you know your clients best, and that while it makes sense from an evaluation perspective to administer at intake, because that way you have a true baseline of where your clients are and can therefore measure their growth more completely, we recognize that many survivors are coming to you, of course, in crisis, and that it may not be an appropriate time to complete an evaluation instrument on them. So again, we really respect the work you do and leave that to your discretion. That said, best practice from an evaluation perspective to monitor client progress over time and program growth is to get that at intake, and then at some identified kind of incremental point in time, whether you do that every 2 months or 3 months, and then certainly at discharge if you're able to complete a discharge, for lack of a better word. We know that sometimes survivors may wind up, disengaging from the program, or that you're not able to retain them in the program, and so that then becomes difficult. But I think this tool provides the flexibility so that you can administer as frequently as you want. It will keep all of that data running for you, and it will also allow you to easily monitor and track the date at which you complete those so that you can really implement that administration on your own timetable. So I also welcome your input here in terms of your own practice and how you handle this at CAST.
Thanks. Yeah, I saw those questions coming in, and just to reiterate your point, I think the adaptability is important to note, and obviously some programs might be shorter term, others longer term. Just to share how we've evolved its use over time, we do not, since it is kind of an involved assessment to complete with a client, and like many of the folks on the call, we are working with individuals right at the start of them escaping a trafficking situation, so it's not part of their emergency response assessment or initial contact, but once they're linked with a long-term case manager, we do use it as an initial assessment, and then, as I mentioned, every 90 days. But what we did also evolve as part of some of the changes was tiered phases that we designate with our services, since in average our clients are with us for about 2.5 years is the average right now. So we have like an engagement phase, a building, and then a transition is what we call it internally. But so depending on what phase they're in, it might be every 90 days, or if they're more stable, every 6 months. But I just encourage people to think creatively with that about what really fits the needs of the clients, but also helps get them good data to be able to evaluate.
Great. We had a couple of questions that relate to whether you are completing this form with the client. I know you said that the the case manager is the one who completes it, but are they working with the client at the time? Is that how you are, at the time that they're using the tool, is that how they're identifying the priorities?
That's a great question. We also consulted with our panels about this very question too, and ultimately landed on that this instrument is designed to be completed by case managers about their clients, not with their clients. So that is a decision point, that is our recommendation for how this tool is completed. Sam, you're welcome to jump in here too.
Yeah, I think we're really trying to make sure that we're trying to avoid adding burden to the clients who are already dealing with a lot. So I think the idea is that based on the conversations with the client, that the case manager would have a lot of this information. That's also why we build in some flexibility, because if they don't know that information, that's understandable. They may not have hit every topic. That's why we build in the flexibility that the case manager can skip an entire category or just one row. If they don't know the information for one row in the instrument, they can skip that as well.
So another question came in. If the client does not identify a particular element as a priority goal, should the case manager still complete that category?
Yes. The way that we conceived of this is that really, that would be our recommendation, but it's really up to you what you're interested in evaluating from from a program evaluation perspective. If you're providing comprehensive services, this tool is designed to capture and track progress on each of those comprehensive services. But as Sam noted in her demo, if, for example, just to arbitrarily choose one of the categories, if you're not providing any behavioral health services and you don't want to monitor that as part of your program, that's entirely up to you. And that's what we really are excited about, the flexibility that the tool allows in that respect. So, but more narrowly to the question, if it's not a client priority, I would still recommend tracking it. It's just that we might want, when I say we, you may have a vested interest in looking more closely or carefully at those particular priority areas that the survivor is tracking, right? I mean, it's just difficult when survivors are rebuilding their lives and we're potentially assessing them on all of these, and most immediately they're just trying to focus on maybe it's job security or housing in that given time, or maybe somebody else is working on their physical health. So we recognize that there's going to be more of an impetus or focus on certain priorities, but still recommend capturing data on all of them if and when that feels appropriate for you and the clients you're serving.
So speaking of flexibility, someone wondered whether they could add a component. Is customization permissible? For instance, this person has spiritual development as a foundation of their programming, but that's not part of the assessment tool.
Right, and Sam, I'll punt that one to you just because you've been leading the charge with the actual instrument functionality and development.
So what I'll say is, if anything that is added or customized is not going to have been validated or found to be reliable. So it would be a separate component that we have not, that our testing has not assessed. That being said, this tool is programmed in an Excel form, which is not, is not the easiest form to just add another line to in that context. That being said, if there's something that you want to add in terms of data that you want to collect around progress in terms of spiritual development, because the data comes in an Excel form that's pretty easy to combine with another data set, that's also something that you could include in an analysis, even if it wasn't part of the actual Excel form here. We're finishing up this study, so we're trying to figure out exactly what things are going to look like moving forward, but that's not something we can offer at this time to customize the form.
So the short
Great.
answer, Susan, then would be no, that it's not possible to modify this existing instrument, but we did create this in such a way that it's easy to be combined with other data that you may be interested in collecting yourself.
Thanks.
Thank you both. Now, I know you mentioned that you created some of these simple charts for people who don't have statistical expertise on staff, but a couple of people expressed interest in some type of chart that would show an individual client's progress or change over time. Is that something that would be fairly easy for an individual program to create, or is there any possibility that you all could create that function?
That's such a great question, and one that we discussed at length. We really wanted to keep going and just keep extending all of the different capabilities of this tool, but we had to stop somewhere, at least during this period, funding period of performance that we're working within, and this is where we've ended for now. That said, we are already cooking up new ideas for the next study, and that is one of the things we would like to do, is to continue to build that out. So for this particular version, we're not able to do that. I wish that we could, but we needed to go ahead and disseminate this out into the field and get it moving. And the short answer is we also began this study just with the intent of actually designing the questions, the instrument itself, and testing. Actually creating this further by entering into, it was going to be a paper and pencil, and then we realized we were hearing that's not what the field needs. And so we really pushed and stretched ourselves here to kind of create this foundational functionality and data visualization. But we agree with you, it would be really, really great to have that display change over time for each client. That way you could look at their longitudinal progress. So thank you for those contributions. It's helpful to hear this feedback that is, in fact, something of interest to you, because we thought it might be, and we hope we can do that in the next iteration.
A question came in about the age group for this form. I know that you allow tracking for services of adults and minors, but is there a lowest age for minors?
Sam, do you want to jump in on that one?
Well, I think, the lowest age of minors is, I think most of the tools that we base this off of, most of their services are adolescents and teenagers. But the measures that are split between minors and adults, generally, like education it talks about grade level. So I think, they wouldn't necessarily apply to a age necessarily well to somebody under school age. But otherwise, I think that the measures we tried to craft to be applicable to a wide range of clientele, trying to cover most of the clientele we think would be included in these services.
Great. About how long on average does it take a staffer to complete this form? Do you know?
No, we don't. I mean, I think there's going to be significant variability depending on how the extent of the knowledge that the case manager has about any particular client, and whether they have, for example, had conversations with that client about each of these domains. So we didn't test for length of administration. I think that's there's probably going to be significant variability on both the case manager level of experience, but also their level of knowledge of their clients.
Okay, related to that, about a case manager's understanding of their client, can multiple staffers complete an assessment for one client if they are each providing different services, for example?
I think we designed this initially for it to be provided completed by one case manager that was working in a program that offered comprehensive services. However, we understand that the reality doesn't always look like that, and that in fact certain organizations may be partnering together to provide those comprehensive services. So I don't think we have a recommendation at this point on how to do that, but that gives us some food for thought. It's part of our dissemination package that we're preparing for next month. We plan to provide not only this instrument, but also some basic recommendations, some of the things that we've discussed even here today. And so that's something that we can give some thought to and potentially make some recommendations for when we disseminate both the instrument and the analogs. We're calling it a supplemental guide, but just some basic guiding principles on how this instrument was designed to be completed. So that's a really great question, and if I could just say stay tuned on that.
Relatedly, someone else was wondering how they might use the instrument if their agency provides one main service and partner agencies provide related services.
Yeah.
Can you envision this? Right.
Go ahead, Susan, I'm sorry.
Yeah, can you envision that same assessment being used across multiple agencies?
I think so. I mean, I think it's less than ideal, but that's sometimes health service operates, right? And so we need to be flexible and adaptable, and I think that certainly this instrument could accommodate that. Insofar as you could have somebody who's a data manager combine those responses, or if you have appropriate confidentiality measures in place and you're accustomed to sharing data on clients back and forth across your partners, your agencies, then I think it would be appropriate for multiple case managers, for example, at various service provider agencies or organizations complete one form on one client. It would require some coordination, but we know that you all do that regularly, so I don't see why that couldn't happen.
You mentioned that you're going to be putting together some information about how the form is designed to be used. Do you have any recommendations on how to train staff to complete the form or how to familiarize themselves with the content?
That was in fact the primary impetus for us deciding to include that supplemental material. And we just had an idea that we learned just from the expert panels that there was so much variability in how people, for example, were conceiving of behavioral health and physical health. And so just to illustrate that example around it, we learned through our processes that some people were, looking at maybe the effects of substance abuse or dependence and the physical manifestations that caused, and some people were scoring clients more poorly in the physical domain because of the implications of substance abuse, whereas we had initially intended that to go in the behavioral health domain. So that is in part why we thought it would be helpful to provide some additional training and guidance on how we initially conceived of these different categories, including their definitions and how to operationalize those definitions when evaluating or scoring, not evaluating, but scoring your client's current assessment. So that, in fact, is part of what we plan, the primary impetus for the supplemental guide and what we, in fact, intend to include in it. Sam, I don't know if you want to add some more to that.
No, I think that covers it. I don't think we've, established a specific plan for how you ought to train your staff, but I think working together to make sure that your staff is consistently completing the tool and has, that everyone is using the same instructions and ideas for how to do that is going to be important.
Yeah, we offer some recommendations that we learned based on the multiple data collection activities throughout our study. I wondered, Susan, if it's not too protracted or too late to do this. I think, Phil, I wonder if you might have some interesting insight here. Going back to the couple of questions that we got, clearly there is a need or the reality that we might have multiple partnering agencies or service providers interested in working together to both provide services and score client status. Do you have any kind of practitioner input on the just on that process?
Yeah, thanks. I noted that question actually. I can imagine it would be particularly unique to certain situations if depending on how close and strong that partnership is, if it's because sometimes there's a big umbrella agency that within it has like a human trafficking program, then shelter programs and stuff like that. So I could envision how that might look in a way that's also adhering to whatever ethical and confidentiality protection guidelines someone has to operate under. But I noted that because I would, for an agency, even if they're not necessarily providing a certain service, if it's appropriate and part of that staff person's role to be having a conversation with their client about that area, even if it's not an area of support you're specifically providing. I do think there's a lot of value in tracking it. And just as an example, you know, I know there might be a variety in terms of agencies that don't necessarily have in-house mental health services, but you still, if you're just doing case management, gleaning a lot of information about maybe someone's access to services or behavioral health goals or anything like that. And I think there is a lot of value in tracking that. Another example would be, you know, we unfortunately don't have ourselves any long-term housing programs for male-identified survivors right now. Hello?
Bill, can I break in for just a moment? Folks, our exit poll is going to close in 30 seconds. So if you can go ahead and quickly take that exit poll. We're not about to end the webinar, but we would like your responses to that. Okay, sorry. I'm sorry, Phil. You were about to talk about distinguishing services for male victims.
Oh, yeah. Sorry about that. And so that's still an area we obviously are, with our male-identified clients, talk to them about their housing status and their access to either support or housing rights, things like that. And that's then become a really valuable data set for us to advocate locally at the policy level for human trafficking survivor housing for male-identified survivors, because we've been tracking that for so long. So I would definitely encourage people to maybe try some different options and see if it fits with what they're already gathering. I did also want to quickly, to one question, go back to doing it with a client and then going back and entering it. One thing we've found useful is, obviously it's maybe not ideal to be sitting there with a client completing on the computer, but if folks are wondering how do you maybe ask the right questions to make sure you're gleaning the appropriate information to be able to complete the tool, some of our case managers find it useful for our tool to print out a version of it or copy some of the entry points so that they at least have like prompts, even if it's just the topic areas, you know, behavioral health, housing, all those things, because even for clients where it's not a priority, you know, we have plenty of people who don't have dental health as top of mind when they first come to us, but because we have that as the caseworkers know that's an area they want to make sure they ask about, that ends up often opening a lot of doors. And even if they're not prioritizing it, then we can go back to it later on and say, hey, remember we had that conversation about dental health, and now that you've connected to a therapist and we've gotten you in this transitional housing program, do you think now is a good time to maybe revisit that? Because at the time you told me you hadn't been to a dentist in 5 years or something and had no access to that. So I think I encourage people to think maybe be open to capturing as much as possible if it's appropriate with the role.
I'm so glad, Phil, that you jumped in on that, because as soon as you had the floor, I was going to prompt you to maybe touch base about that piece too, completing it with the client versus not. And to your point about printing it out, one of the things that we are doing as part of the compendium that we'll be delivering to those of you that request it next May, the instrument and the supplemental guide, also just a PDF form so that you can have that in front of you. It is not designed to be filled out. We want to be very clear about that, but it can prompt you, like Phil said, to have that list of categories in front of you to make sure, so, hey, you know, can we talk a little bit about how this part of your life is going? So thanks for that, Phil.
All right. I know you talked about trying to fit so much information about potential clients into your 6 vignettes. But a question came in, did any of the vignettes contain individuals that identify as members of the LGBTQ community?
Sam, do you want to talk about the vignettes, the hypothetical cases?
Sure. We developed the 6 vignettes trying to make sure we included a spectrum of potential clients. And that included U.S.-born and foreign-born clients, male and female clients, minors and adults, And one of those vignettes did include a young man who identified as LGBTQ. That, given that we were trying to cover a lot of ground, we did only have one vignette that would fall into that category, but that was something that we were thinking about.
A question came in, would you all recommend using this tool with survivors of domestic violence as well, or is it limited to trafficking?
That is a very interesting question. That's a really good question. I'm not sure that I'm prepared to answer that right now. I may need to think about it. I wonder if that person would be willing to send me an email. I would want to consult, I think, with my team, and I think that by and large, many of the outcome categories would be applicable. I think certainly the element of rebuilding a person's life and kind of assessing progress and growth towards holistic health and well-being could certainly be reflected and captured here. I just would be cautious that this was in fact designed for a different population and informed by a different population. But that said, I do think there could be some salience for particular measures included in this tool. I would be happy to continue that conversation. In fact, with any of you who have questions, we really encourage you to reach out and email if we're not adequately answering your question, or if you have more, or particularly in this instance. That is a unique question that I have to admit I have not considered.
Well,
Sam or Phil, if you have any commentary, I invite you to jump in as well.
Sorry, was that for me?
I just opened the floor. If any of you had any information you'd like to share, otherwise we could move on.
All right. Well, we'll look to see if there is any follow-up communication from that individual. The good questions keep coming in. Have there been any thoughts about collecting some demographic information with this tool in order to gain information about who's participating in services and how those services are delivered? Or, Phil, was that information gained through a companion tool?
Sorry, was that question designed for me or for Phil?
It could be for either of you.
How about we tag team it? I can start by saying we absolutely, look, we do research for a living, so we're always interested in looking at demographics too, and to better understand subpopulations and how certain clients may be experiencing or facing different types of challenges. That said, we did not include that in this tool. We focused exclusively on outcomes. I understand, and part of that was because I think we suspect or know that many of you at the programs are already collecting and tracking that data. So the idea here is that that data could be included with the Excel file of data that you export here or use, or at least easily integrated and combined. As Sam was mentioning, our goal is to make this a really easy user-friendly and easily accessible format of data so that you can manipulate it and add it to other data that you're already collecting for your program, checking your program clients that you serve. But Phil, I don't know if you want to say any more to that too.
I would just maybe to that point highlight how something I mentioned a little earlier is how we've always been, I think, starved for data in the anti-trafficking movement. So obviously this tool is a huge asset to data collection, but for those who might be already collecting some of that, or they already have a database or use Excel, to Stacy's point, I'd encourage people to try and figure out ways they can integrate it, whether it's through the client number ID or connect it to what they already have. I know that's something we've been leveraging, so that since we do collect demographic data, we can, some of those charts, we can, run different reports based on if we want to see how our, as I mentioned, how our like minor clients are doing, or our LGBTQ plus identified, like all of those questions, there'd be a lot of interesting information you could generate if you were on your own already collecting that and finding ways to link it. So That's a great question. I think a good jumping off point within your agency too to maybe say we need to look at how we do those things and integrate them.
Great, thank you. Back to the idea of using this tool with victims of other crimes, one of our participants pointed out that victims of trafficking might also be victims of sexual assault or domestic violence or other crimes. Is that part of the understanding of using this tool?
I think we in this field recognize that polyvictimization is very common, right, and that we're not oftentimes serving populations or clients that are only experiencing one type of violent victimization. So in that spirit, yes, we recognize that. However, we attempted here to focus, I would say narrowly, but I'm reticent to use that word because we feel like it has a lot of breadth, this tool, but we focus narrowly on this particular type of victimization, and by this I mean trafficking. I do think that a lot of the similar, say, constructs or measures, right, we are interested in measuring for survivors of sexual assault, sexual violence, domestic violence, or ITV, and even teen dating violence. So many of these could be salient. I mean, for example, we're tracking things like life skills and public benefits and social support and parenting, and those things are certainly salient across the spectrum of types of victimization.
Thank you. Another question, how can this tool help folks assess future vulnerability for trafficking?
We did not design this tool to be to necessarily serve at-risk populations, and so these are designed to be. This is designed to be completed on survivors that have already been identified. So this is not an identification tool; it's a program evaluation tool. I'm not sure if that.
Well, to be clear, I think they were talking about a client who is at risk or who is vulnerable of being trafficked again. They may have started accessing services, but they continue to be vulnerable.
Sure. Okay, that is very helpful. Thank you for clarifying, Susan. Right, and I think we are aware of that challenge just from our, talking with so many survivors and practitioners in the field, case managers in the field, that a lot of times that the clients they serve may go back into the life. And so I think that really is a program, a practitioner call, and maybe Phil, even you can speak to this, but that would be a way that I think the data can really inform the types of services that you are providing and the level of engagement and types of retention type activities that you're looking at. So if, for example, you know that your survivor who's in your program continues to struggle with maybe even some of the client priority items that they've identified, and that you are concerned that will discourage them in any way, or that they're at an increased vulnerability at this particular juncture in their life, maybe because their scores are regressing, right? And that was, something that we all know, of course, is that it's not a linear path to healing, and that we're not expecting that these scores to continually go up at every single assessment. Some of them might, some of them won't, but that's just another benefit, we think, in being able to not only engage your clients, but systematically assess them on each of these categories so that you can really see and monitor and recognize when there is slippage, to be able to say, oh, you know what, I'm noticing when I really sit down and look at this on paper that there is some, I hesitate to use the word regression, but I will, for lack of a better word right now, some regression in these categories, and I'm worried about this level of increased vulnerability, and really inform your outreach and efforts based on that. But Phil, I would love to hear from you on this topic.
I think that was really well put, actually. I think, to your point, and as we all know, there's no necessarily key one predictor of or any one vulnerability for someone either being re-trafficked, or, as you know, a lot of clients we work with might encounter some other form of exploitation or victimization as part of their recovery process. So I think, as Stacy put so well, just this being another way to have that insight and be regularly monitoring it in a way to inform what approaches you're taking in client work, what outside support or other referrals or supports you're trying to provide would be key. So, you know, for example, if you're really noticing that either someone's, as Stacy mentioned, made some back steps in their housing stability, or they are consistently in vulnerable housing situations, I could see that as something that's kind of a red flag, and as we've seen that be with a lot of clients. So definitely it would be a way to have that insight, for sure.
All right, I think that is all of the questions for today. I want to thank all three of you. This has been fascinating and really inspiring to think that we could really be measuring outcomes in a way that helps us get the best for our clients and help them achieve their goals and move on to healthy lives. Folks, if you did not have an opportunity to take the exit poll, please do take a minute and give us your reactions to this webinar, including whether you would like a copy of the tool when it's available and how you plan to use the information from this webinar. Thank you again, Stacy, Sam, Phil, for all your work and for sharing it with us today.
Thank you, Susan, for the great work you do at the Center for Victim Research, and thanks to my co-presenters and for all of you who attended and offered these great questions. I think they are pushing our thinking further, and for that we appreciate your collegiality.
All right, goodbye, everyone.